What is parosteal osteosarcoma, and how is it unique? Parosteal osteosarcoma is a rare type of bone cancer that stands out due to its unique characteristics. This tumor develops on the outer surface of the bone, specifically from the cortical bone layer near the periosteum, which is the outer fibrous layer covering the bone. It most often occurs in the metaphyseal region of long bones, particularly around the knee, affecting the distal femur and proximal tibia. This condition primarily affects adolescents and young adults, with a slight female predominance. What sets parosteal osteosarcoma apart from other types of osteosarcoma is its origin on the bone surface rather than within the bone marrow. It is generally classified as a low-grade malignant tumor, meaning it tends to grow slowly and is less aggressive compared to other forms of osteosarcoma. This slower growth rate often leads to a better overall prognosis and a lower likelihood of spreading to other parts of the body. When viewed under a microscope, parosteal osteosarcoma shows a well-differentiated appearance. The tumor cells appear relatively normal, with low cellular atypia and low mitotic activity. This is in stark contrast to high-grade osteosarcomas, which typically display more aggressive characteristics. Radiologically, parosteal osteosarcoma presents as a broad-based, lobulated mass that is attached to the bone surface. A characteristic feature is a linear radiolucent zone that separates the tumor from the underlying cortex, except at the attachment site. Importantly, this type of osteosarcoma does not invade the medullary cavity, which is the inner bone marrow space. This lack of invasion is a key distinction from more aggressive forms of osteosarcoma. Histologically, parosteal osteosarcoma is characterized by irregular bony trabeculae and spindle-shaped fibroblastic cells within a fibrous stroma. Sometimes, cartilage may also be present, but the marked atypia seen in high-grade tumors is absent. A notable molecular feature of parosteal osteosarcoma is the amplification of certain genes, such as CDK4 and MDM2, which can assist in diagnosis. However, it is important to know that about 10% of parosteal osteosarcomas may undergo dedifferentiation into a high-grade sarcoma. This change significantly worsens the prognosis and necessitates more aggressive treatment. In summary, parosteal osteosarcoma is unique due to its origin on the surface of the bone, its low-grade nature, and its generally slow progression. Its distinct clinical, radiological, and molecular features help differentiate it from other bone tumors, guiding appropriate management. Always consult healthcare professionals for personalized medical advice regarding any concerns about bone cancer or related conditions.